Hi, everyone. Welcome to our third episode of Character Clinic. My name is Karla,
And I'm Haley.
and we are here to talk about our most relatable fictional characters and how we would work with them. Today, we are going to be talking about a series that a lot of you might know. Haley, what's the movie called?
So the movie we'll be focusing on is called The Ballad of Songbirds and Snakes, the Hunger Games prequel movie.
We're really excited. We, as always, have a lot to say.
We do, yeah. Lots of thoughts, so this might be a bit long.
We are going to get started with our intake. What we would like for you guys to do is in the comments as we're doing the intake, just take a guess who you think the character that we're doing is. So today I will be the counselor and Haley will be our mystery character. Okay, so we will go ahead and get started with our intake. What brings you into counseling today?
Well, I'm not really sure that this is going to be very helpful or that this is really going to change anything. I'm sure you're great and great at what you do. Um, it's been brought to my attention that I should be here. There are people that think that this will be worth something to me or them, to be more honest, worth something to them. Um, I feel like sometimes there are just things that can't be fixed and can't be changed, and things that are really awful in this world, but much bigger than anything that I can do about it. And so here to talk about that, I guess, but I also am very aware that like there's nothing that you and I can sit here and do about it. So just throwing that out there.
Okay, yeah, I really appreciate you being honest about that. It does kind of sound like you're feeling just generally helpless.
I think that's not inaccurate. And in some ways, maybe a little too helpful.
Yeah. What I'm hearing you say is that it kind of hit the nail on the head.
I guess. Um I don't know if you knew, you must not really know who I am, because I think if you did, you wouldn't call me helpless.
Well, can you tell me a little bit more about that?
Well, I have received recognition for my work that should never have been done.
I'm hearing you say that you're not proud of it.
Absolutely not. And they expect me to go around presenting myself to the world as if I am.
Mm. Yeah. When you say they, what do you mean by that?
Everyone. The
Everyone.
people in power, the people above me, the people with me, the students, the civilians, everyone. This is just how the world is now.
Okay. Well, I know that you're here because of work. Can you tell me a little bit more about work?
I spend my time catering to little money grubbers, little future leaders who will do nothing but bring more turmoil and violence and evil to this world. And I'm supposed to hold their little hands as they learn how to do that. It's the most miserable job in the world.
So it sounds like you're not proud of what you've done, and also work is miserable.
Yep, there's nothing that can be helped here.
Yeah. It feels pointless to even be here.
Yes.
Yeah.
And then, truthfully, I suppose I would be completely remiss if I didn't just bring up the actual point why I've been suggested to come. And that is, uh, in dealing with all of this, sometimes I just can't be in my own head. I just can't exist in this world the way that it is. And so I have to do something to help get me through. And you know what? Sometimes that something is not the healthiest choice, but I can't get through this any other way. So we're stuck here.
I see. So I'm hearing you say that because work is miserable, you're not proud of um, what other people see as accomplishments and things to be proud of, that you have coped with that in a particular way that maybe isn't the best. Can you tell me a little bit more about that?
Well, to be really frank, I had this idea that was a joke. It was not real, and it was made real. And now I'm responsible for a lot of violence, and I'm credited for being responsible for it, even though I did not want that. And the only way that I can get through this life knowing that that's how people see me is by using the hardest substance I can find to take myself out of my reality.
Yeah. You're coping with all of that by numbing yourself.
Exactly. Even at work, I'll show up to work completely high.
Thank you for sharing that. I know that that can be really hard to share. And I do want you to know that everything that you say in here is confidential unless I am worried about a potential suicide attempt or something happening to somebody else. And so I really appreciate you sharing that with me. Can you tell me a little bit more about how often you use this substance and what it is?
Every day. They call it morphling. But
Okay.
to
Yeah.
your point, fortunately or unfortunately, however any given person might see it, I'm not thinking of killing myself. But I do think it would be easier.
Yeah. Can you tell me a little bit more about that? It being easier?
It would be nice if I didn't have to live through this life.
Hmm. You're really suffering. Living is painful.
Yeah, that's a great bottom line right there.
So the way that you've been coping with it is through the use of morphine.
Yes.
Yeah.
And I really just don't think that there could be any other way through it. I'm not going to kill myself at all. So I have to find some way to exist in this reality.
Yeah. So you've made the decision that even though I think it would be easier, I've decided that I am going to continue living, and so I have to figure out a way to continue to do that.
Yes.
Yeah. Okay. So can you tell me a little bit more? So you mentioned that you use morphine all the time, and it's gotten to the point where you even use it at school. Can you tell me a little bit more about what you're trying to numb? So you mentioned that you are living with something that was a joke. Can you tell me a little bit more about the feelings that come up, body sensations that come up when you think about it?
Dread, panic. Feels like my heart just kind of stops. It's like every time I'm reminded of it, I get just dizzy. And it's like I feel my blood go cold for a second.
Mhm.
And it just like creates this extremely uncomfortable like churning in my stomach, and it's like almost like I'm about to throw up.
So it's very distressing.
Yeah,
Yeah. Have you considered that part of that could be feelings of guilt?
absolutely. Yeah, that is entirely what it is.
Yeah. So when you start to have those feelings of guilt, the easiest way to cope is to use the morphine.
Yeah, that's the only way that's gonna work.
You feel like nothing else will work.
Nope.
Okay. Okay. How is your sleep?
If I drug myself enough, I can pass out. That's about it.
Hmm. Okay. So you need morphine to go to work and also to sleep.
I need it to function at all.
Yeah. So without it, you just would not be able to function.
No.
Okay. Thank you for being open about that. I know that can be um, really hard, and for a lot of people can feel um, shameful to talk about.
It is, but I exist in a world where the only sensation left to me is shame.
Can you tell me a little bit more about that?
There's nothing else that consumes my thoughts, and the thoughts are endless and all encompassing.
Hmm. I see. So that's your whole life. Is that
Yeah.
shame? Yeah. What are other ways that you've tried to cope with the shame that it sounds like have not been successful or haven't been helpful? But I think for me, it would still be helpful to hear them.
Um, there really hasn't been anything else. I tried to tell people that
Hmm.
it was just a joke, that none of this should be real, but like nobody listens. Nobody does anything when I say that.
Yeah. Nobody hears you. No one takes you seriously.
Yeah. Except for this one time.
Can you tell me about that time?
Well, the one time that they took my joke seriously.
I see. So the joke was taken seriously, but when you tried to take that back and let people know it was just a joke, that was just completely unheard.
Yeah.
Yeah. Gosh. I mean, yeah, it that sounds like a lot to deal with, especially if it's become this huge thing and now you have to deal with the consequences.
Hmm.
So what have the consequences been?
Well, they put me in my current position and they expect me to help run the scenario, help completely continue orchestrating what I theoretically put into place, forcing me to have a front row seat to it every time.
You feel very forced to do this.
Yeah,
Yeah. As if like it I'm hearing you say that it feels like you didn't have a choice in the matter.
right.
Okay. So on a scale of 0 to 10, 0 being no guilt and 10 being the most guilt you could possibly feel, how much guilt would you say you feel on a day-to-day basis?
Like a 10.
Oh god, I can only imagine how awful that would feel. It makes sense that you would want to numb that,
Hmm.
especially if you felt completely helpless, like there was nothing that you could do.
Yep. I I don't know. At one point I guess I believed that if I kept showing up then maybe I could get people to listen when I
Mhm.
tried to let them know that maybe this shouldn't be happening, but it keeps happening anyway.
You thought, if I continue to say something, something will change, but nothing has changed.
Right.
You've continued to be ignored.
Hmm.
That's that's awful. At work, do you have friends, peers, or just in general, do you have a support system, people you can talk to?
Nope. And certainly, even if I did, nobody that would understand.
Yeah. No one that could relate.
Hmm.
That sounds really lonely.
It is.
Yeah. Is there anything that you enjoy doing? Any hobbies?
No. I cannot bring myself to focus on anything else. And so the only time I can get any kind of relief is when I'm high.
Yeah.
Sometimes it vaguely amuses me to torment the people that I'm surrounded with who actually think my absolutely insane idea was a good one. The people who really like perpetuating this awful thing, it amuses me to put them in their place,
Yeah.
make them feel the way they make other people feel, look down on them.
You want them to have a taste of their own medicine?
Yes,
Yeah.
yes, absolutely.
Okay. I think those are all the questions I have for you today. Do you have any questions for me before we finish?
Not really. I mean, part of me kind of wonders what could even be accomplished here and what you would want to do. But, or if you have any advice for me, any
Hmm.
alternatives I can take, any ideas. But I also kind of don't expect you to have any. So
Yeah. You know, I just want to point out that I'm hearing just a little bit of hope there.
I guess, I mean, I'm here. And the fact that, yeah, I mean, it was suggested to me that I do this for
Hmm.
specific reasons. They don't want me showing up high to work anymore. But I guess I, I guess I do still want something. If there's something that could help, I would want that. I just don't really know that it exists.
Yeah. Yeah. Actually, that brings me to a final question. You mentioned that you don't want to show up high to work anymore. If I realize that you feel, for the most part, that nothing can really be changed, but if there were things that could be worked on, what would you want to work on in counseling? What would you want to gain from this experience?
Well, I would like to not have to show up to work high anymore. It's not
Hmm.
that I don't want that though, because I literally cannot think of an alternative or a way to stomach being
Hmm.
there without it. But if there were something, I would want that.
So I'm hearing you say that you would want to potentially gain some different coping skills if they could work,
I guess you could say that, yeah.
and then maybe make some sort of change.
Hmm.
I think that those are definitely things that we can work on. Okay, well, that's going to be it for today, and I will see you next week.
Okay.
Okay, how do you feel like that went?
I feel like it was hard. I felt like from the client's perspective when I'm really trying to get into his head and thinking about people that I have met who struggle with addiction, who
Hmm.
struggle with trauma, who struggle with guilt, who struggle with this mentality that the world has handed them this experience where they can turn around and see no other viewpoint that
Hmm.
makes any kind of sense to them. This, um, as you described, helplessness. And I would also throw the word in hopelessness. Trying to sink into that mentality, it was almost like answering the questions felt so tedious from the perspective of there's nothing I'm going to get out of this. So why am I even
Hmm.
bothering? And so I'm going to give the bare minimum kind of effort.
Yeah.
Um, I think I think this character has lost a lot of his sense of hope. I think in taking on the mentality of this client really informed just like even deeper some of my understanding of clients that I've experienced in real life
Hmm.
that have gone through these type of really big hard feelings and getting to this point of hopelessness.
Yeah, I agree. A lot of times when someone does experience those feelings of hopelessness, you can feel it in the room. It it feels just very heavy in the
Yeah.
room. It's really hard for them to see any way that things can be different. That's kind of what I was getting from our character, which I wonder if we should go ahead and reveal who the character is. Haley, would you like to
Absolutely.
do the honors?
We were talking about Dean Highbottom. And I that probably became quite clear. It was a dark place to be in his head. That was a little tough.
Yeah. As the counselor, whenever I see clients like this, I it can be easy to identify when someone is coming in and potentially struggling with depression because the mood changes sometimes. Like it can feel a lot heavier, and sometimes clients will speak slower. Their thoughts seem to be more, it seems a lot harder for them to see any positives at all. And even um, see things as neutral. They tend to see a lot of times only the negative. Even as me and you were doing this intake, I also felt that pressure, like that heaviness of the dean, um, feeling that depression, feelings of guilt. So it's definitely very different from who Haley is.
Yes, it's realistic because, as counselors, our mood is going to shift appropriately towards where we need to be. We have this phrase in counseling and in learning counseling in school, which is meeting the client where they're at.
Mhm.
And grammar aside, that is a really important way to focus on recognizing the mood state that someone is in. And instead of trying to pull someone dealing with severe depression, grief, severe like guilt and shame and addiction, instead of trying to pull them up to my level of like,
Mhm.
I'm in a good mood, things are okay. What we need to do is reach down to where somebody is and give them a gentle ramp that can help them get to a more neutral place. And like I mentioned earlier, with your brain um, deeming those actions as pointless and thus not providing you the energy to work on them, we have to get to a point where the brain is more willing to see some kind of light at the end of the tunnel to allow itself to allocate energy towards those positive thoughts. Because I like to
Mhm.
tell my clients and my students this a lot, of this idea that your brain is like a miser, that it is extremely greedy with where it allows you to take energy. And if you have decided, and not even through like a cognitive intentional kind of decision, but if your brain has deemed something pointless, it's going to be really hard for you to summon energy towards that thing. And when people feel hopeless, that's exactly what happens. Um,
Yeah.
and so it is something that can really affect the mood in the room, which is what it is supposed to do. We're supposed to have that space to be able to address that mood honestly and openly, as opposed to like in the rest of the world outside of a therapy office. People say, "How are you?" And you're like, "I just have to say that I'm fine." You know that meme that's been going
Right.
around. Those kinds of things of this being one of the places where it is acceptable and welcomed and recommended that you're able to address those darker moods that maybe we hide from people in our real lives.
I completely agree. As counselors, we have to meet clients where they are. And especially in that first intake, I mean, throughout counseling, but that intake, you you are trying to, as the counselor, assess where this client is, but they're also trying to gauge if, and maybe not even actively, but can I muster up even a little bit of hope in this process? Do I like this person? Do I feel like they hear me? Can I at least come to the next session? Especially clients dealing with hopelessness, helplessness. it's really important to meet them where they are and to maybe provide a little bit of, like a little string of hope, but also to not try and, like you said, have them meet you where you are, because that can feel like, well, you're just wanting me to look at the positive. Like everybody already does that. Everybody's already telling me, well, just do this. And it can come across in a way that you don't want it to. I'm
Very
curious. Oh,
invalidating and dismissive to just be
yeah.
like, "Oh, you're fine. Don't worry about it." You know?
I'm curious, Haley, do you feel like I was able to meet um, the dean where he was in that moment?
I do. Yeah, absolutely. Um, I think that was a really good example of just allowing the space to be open to accept the dark thoughts. And that is kind of where eventually he was able to open up a little bit more and a little bit more, even though there was clear reluctance. Um, but getting to a point of, okay, well, you didn't react with recoil and shock and horror
Mhm,
when I said things about what we will talk about in a moment as passive suicidality,
mhm,
or things about feeling so hopeless and being in such a dark place when you didn't immediately jump into what people without this particular training can sometimes do,
mhm,
um and being like, oh, but let's focus on the positive things. How about let's
mhm.
immediately do some gratitude exercises, those kinds
Yeah,
of things. And instead being able to acknowledge, wow, that is really hard, and you do have these really intense feelings, and that is really awful, and just allowing that to exist in its truth
yeah,
is going to show me that you are a safe person for me to be able to continue talking about this with.
yeah. One last thing that I do wanna say on this topic is that High Bottom mentioned feeling like it would be easier if he didn't have to deal with any of it. And to me, that reads as passive thoughts of suicide. Of course, we would always do a suicide risk assessment to see where that person is. And do they have a plan? Do they have intent? But that is a common thing that we hear from clients who struggle with depression, is that it might be easier if I just wasn't here. And so I would not want to then scare them by just immediately going into like, okay, well, do you have a plan? Do you have intent? It's definitely a more gentle process. And I think it's really important that people know that in counseling, when I ask the question about SI, which is suicidal ideation, my goal isn't to send a client to an inpatient facility or to a higher level of care. My goal is to better understand what's going on and how we can work on that. And so, um, if there is a need for higher level of care, then there's a need. But that's not my goal in the intake. So, of course, I would do an assessment. And if, I was really afraid for that person's life, then there would need to be a plan and we would assess, like, does this person need inpatient care? But when people are having passive thoughts, there isn't any intent, there isn't any plan. Um, it's not something where we just immediately send someone to inpatient. So I think that people can get really scared to even say anything. And I really want people that are listening to know that that's not our goal in counseling. Does that make sense?
Yeah, it's not like the immediate end goal
Mhm,
situation. I also make a point of communicating this to every client and every intake during the
mhm,
conversation about confidentiality, and during the conversation about times that we might have to take this conversation outside the walls and just the two of us. Um,
Mhm.
and acknowledging that, we must check for suicidality, whether it's active or passive, and how high that risk is. Um, and if it's present and if the risk is high, then what we want to do is figure out, and I like to emphasize this collaborative approach where you and I together figure out what that level of risk is and what the most appropriate, and there's a phrase in these types of environments called least restrictive environment,
Mhm.
the most appropriate level of care for the level of risk that there is present. And sometimes that just means, okay, well, you know what, we'll meet twice a week. And sometimes that
Mhm.
means different levels of safety planning. And
Mhm.
sometimes it does mean intensive outpatient, partial hospitalization, inpatient, but only when that risk and that collaborative discussion about how we can address this most safely in the least restrictive environment leads to that conclusion.
Exactly.
And now, while we can't guarantee that every other counselor takes the same approach that we do,
Yeah.
um, what I can say is that most counselors have situations set up where they allow for free consultations. And that would
Mhm.
be an excellent question to ask in one of those situations when you're kind of looking around to see which clinician might have the best fit for you. And asking, when a client talks about suicidality with you, what is your response? And using that as a gauge for, is this the person that's going to work with you in your best interest, including your safety, but also including meeting you where you're at the best? That is a fantastic one of those questions that should definitely be included.
Even in your intake, you could ask
Mhm.
if you wanted to.
Right.
Um, because again, it's to gauge whether they would be a good fit for you. Also, it's not just so that they know what's going on with you, but also, do I feel like we would be a good fit working together? So you can always also ask them in the intake.
I think we mentioned some of the things right coming off of the intake about what exactly Dean Highbottom is going through and dealing with.
Hmm.
So, what's really interesting here in our first time in this podcast talking about a really morally gray character and someone that definitely has some really strong inner demons of times that, yes, he feels a lot of guilt and shame, and he's dealing with some very dark thoughts. And also, these come from things that he's done that he would not be unjustified in saying, I did something very regretful. And joke part of that aside, he is currently employed within the system of maintaining the Hunger Games, and no change has been made on his part. And so, an interesting question that comes of this in recognizing that about this character is, as his therapist, I'm really curious, Karla, where you would go with this and what some of your short and long term goals might be for him.
I would say that based on the intake, there is a substance dependency on morphine. And so that's something that would need to be worked on. It sounds like he uses that to, well, he said that he uses that to cope and to numb, and he uses it all the time. Can't function without it. And so that's something that would need to be addressed. I would say for short term, I would want to work on the depression. I would want to work on noticing those cognitive distortions, is what we call them in CBT, noticing the patterns of those and how to change his perspective, how to change how he's seeing things. Something I think is really important to know: CBT, cognitive behavioral therapy, gets a bad rep sometimes because people think that it's all about, like, just look at the positive. And that's not what it is at all. Actually, you're looking at cognitive distortions, so thoughts that might be unhelpful to you, and trying to change those thoughts, or trying to look at those and evaluate those thoughts and to make them into more helpful or more realistic thoughts. So in his case, I think that a lot of the thoughts that he's having are very um, lead to feelings of hopelessness and helplessness. So I can't do anything about this. This isn't, there's nothing will change. And something that can be helpful is helping him to see that that's not true. It's not true that you can't do anything about this. It's not necessarily true that nothing can change. It's not true, maybe, that there's nothing that you can do. And so that doesn't necessarily lead to like a happily ever after or just being positive. But it is a more realistic way of seeing the situation. And then it can potentially lead to feeling less hopeless and helpless and feeling more empowered. And so I would want to just short term work on recognizing those thought patterns. So psychoeducation on depression, recognizing thought patterns, and then potentially starting to challenge them. What you would also want to work on immediately is the substance use. I have to say that I this is one of the areas that I don't work with, and so I would probably be referring him out because it is such a big part of what he's dealing with. Um, but I do think that that's something that would need to be worked on. Also, just some more coping, just immediate coping skills. It's really important, I think, that if you want to work on on replacing the coping skills that he has had, or the ways that he's coped all this time, before taking that away, you do need to have some other coping skills to rely on. So a lot of immediate coping skills for the feelings that he's having. Haley, how about you?
Yes, I completely agree. In terms of whether or not I might work with him, the magnanimity of everything that he's experiencing, while I do work with substance use, and so I'll
Hmm.
speak to that a little bit, I think he would really benefit from maybe a bit of a team. And I would like to see him, and I would like for him to also go to a specialist for substance use. Because while I do see clients where that is their primary presenting concern, with just everything that needs to be tackled for him, it could be really helpful to have someone actively with him. His risk level in substance use is very high, and like we talked about in the intake, and as you saw in the movie, I talked in the intake about heavy use, daily use for sleep, use during work, those kinds of things. It's not just a minor, "Oh, I'm going to cope with it when I'm not feeling so good." He is,
Yeah.
at least the way I portrayed him in the intake, I portrayed very heavy use. And in that regard, he might need someone who is very active and present in his life, working with him through this. Um,
Hmm.
and so I'd like the idea of maybe him seeing multiple people for that, and me for the underlying emotional concerns that led to this particular type of coping mechanism. This is
Yeah.
also a great opportunity to give an example of what meeting a client where they're at looks like, which is recognizing, as exactly as Karla said, that we can't take away a coping mechanism, no matter how unhealthy it is, with nothing to catch you underneath it. There has to be a replacement. You should think of the image of Indiana Jones trying to remove an idol from a weight pressure sensor and immediately trying to replace it. And how severe that would be to take it and not replace it with something else equally as heavy, right? So that would be
Hmm.
the goal, is finding something else that can be close to as impactful as the morphling. That would be step number one in trying to address reducing that morphine use. Sidebar, because it's clearly related to real world morphine,
Hmm.
when we start talking about substances that are very dangerous, this would involve not simply even a counselor and maybe an addiction specialist, but also a medical team to
Yeah.
safely reduce use. Because
Yeah.
as we know, there's a lot of things that you cannot simply just quit using without significant impact on your health. There's a lot of times that a person can die simply from the withdrawal symptoms. So that's an
Yeah.
important thing. We would need a medical team to help him through the reducing process of how much he
Yeah.
uses. So absolutely, those are really, really involved in short-term goals.
Mhm.
As he's going through all that process with our team that we've built for him, replacing those coping mechanisms would be more our approach, and addressing maybe perhaps in the long term some of those underlying thoughts and feelings, the shame, the guilt that led him there, and those core messages that he's internalized that has become, as Karla talked about, the cognitive distortions of, well, there's nothing I can do, everything is hopeless, the world is hopeless. With, okay, there might be some things that I can have influence on. I can't control the world or people, but I can have some level of influence on what's going on around me. And for Dean Highbottom, that would look like actively taking a role, which we can acknowledge he is not doing, but actively taking a role um, in ending the Hunger Games. But then in other, maybe perhaps more realistic people in your life, someone that you know who's dealing with severe depression like this, um, it might look like helping them see that there would be some worth to summoning up that energy and motivation that's so hard to find towards something that so far has felt really hopeless, like talking about and trying different coping mechanisms. That would be extremely important. And that would come from addressing that shame and guilt and being able to acknowledge it and let some of it go. And you might think to yourself, okay, but real people in real life, they do deserve to have that let go, but maybe Dean Highbottom doesn't deserve to have that let go because of what he did and his involvement here, or should we say maybe lack of action and not doing more to stop the Hunger Games. What I would say to that is the only way to get a person to the point of finding that motivation and energy to work towards making that successful change is by relieving themselves of that shame and guilt, which creates such a strong block in your ability to perceive something as worthy enough to do something about it. And so, even though we can say, yes, Dean Highbottom had a role in creating the Hunger Games, and he's not currently doing anything of substance to stop it, it would involve exploring with him ways to set aside that shame and guilt to be able to gain just enough self confidence and just enough hopefulness to be able to take that stand. So, if he was going to do that, it wouldn't be by piling on more shame and guilt. It would be by going in the opposite direction. I'd love to hear what are some of your more long term goals, Karla, because you had some fantastic ideas for your short term. So, in the long term, what would you like to work with Dean Highbottom on?
I actually want to say that um, going back to short term, I think realistically, if I were to um, have the dean, high bottom, if I were to have him in an intake, I think realistically, I might recommend a residential treatment facility for him because of that need for a team. And so I think that I potentially that might be my recommendation. Long term, I would want to work with him on better understanding his values. So, what are the things that matter to you? And are you following? Are you acting in line with your values? Are you not? Where are the areas that you're not acting in line with your values? And how can we change that? Because a lot of times when people start to act in line with their values, they start to gain more self confidence because they feel like the way what they believe and how they see themselves is starting to match up. And so rather than potentially putting whatever my values are onto him, I would want to know what matters to you. And maybe he hasn't even looked at that before. Maybe he hasn't thought about it. And a lot of times, guilt and shame can come from like, I know that something is wrong. I know I'm not doing something that I feel like I should be doing. And yet I don't know how, what, or where to even start. And so I would want to work on looking at his values, better understanding those, and then better understanding where are you not acting in line with your values? Where are you And where can we bridge that gap? How can we get you closer to the person that you want to be based on your values? That could potentially be, I want to figure out a way to take a more active role in stopping the Hunger Games. It could also be, I want to denounce all of this. I don't want to be involved anymore. And maybe that means that I lose all of my status. And that's just what it's going to be. I want to relieve myself of this responsibility. And it could be a lot of different things. So that's kind of something I would want to work with him on long term. The other thing, and I think this is a little bit of a difference in approach, because I think that I would want to work with him on recognizing the guilt, but not, how do I explain this? Not letting the guilt consume him. So, in my opinion, I feel like sometimes, a lot of times, you're feeling that guilt for a reason. And there is like a legitimate reason behind those feelings of guilt. And there's something that you can do about it. And so I would want to work with him on, let's look at this guilt, because up until now, you've been kind of numbing. So let's look at this guilt. What is the appropriate action to take to hopefully relieve the guilt, or even just to live with it? The Hunger Games is something that you created as a joke, but it is still something that was created, and there was some role that you played in this. How do we work on looking at it, making it right in some way, and living your life? Because holding on to that guilt forever is just not good for you, but it doesn't help anybody else either. And so I would want to work with him on, let's actually look at this guilt instead of just making it bigger by like completely separating yourself from it. Let's just look at it head on, figure out what you need to do, what you want to do to address that, and then let's figure out how to move forward. So I think that that's kind of what I would want to work with him long term on.
Yeah, you're speaking to concepts of radical acceptance of, I
Mm-hmm.
know that this is what my reality is, and I'm making peace with the understanding of that. Right now,
Mm-hmm.
as he is, and as he presented in the movie and in this intake, he's incapable of being able to address that without
Mm-hmm.
distorting his consciousness. And
Yep.
it's just too traumatic for him to be able to handle. And so, ideally, yes, what we'd want to get him to is a place where he can look that in the face and maybe still recognize that that feeling of guilt is there, but also
Mm-hmm.
recognize, okay, where do I go from here though? What can I do about it? And
Yeah.
while it's true that in this world, there are real world, really big picture things that our clients bring into our office about world current events that are devastating, that you as an individual can't go snap your fingers and fix. And there are times that we can talk about what can be done realistically. And now,
Mm-hmm.
it is quite different with Dean Highbottom recognizing that he does have a lot of power and authority and influence here, that there's a lot that he could do if he was able to
Mm-hmm.
gain that energy back and be able to face this and take some action there. That's not necessarily true of the average civilian, but that would absolutely be one of the goals that we could incorporate, that he's kind of deemed hopeless. That might not actually be hopeless with the amount of power that he does have, that, as Karla pointed out, he has accepted. He has accepted this position in the academy. And maybe at one point he was telling himself that he'd do so that he could make change from within. But in many years on, not having made that change, there's definitely something different that could be done there. And so getting him to a place
Mm-hmm.
where he feels congruent in his values, which is it's very fun that you bring that up, because that is a very person-centered approach and goal, is the
Yeah.
congruency of actual and ideal self. um
Mm-hmm.
but coming into, okay, how am I This is a known thing. The most likely scenario of true life satisfaction comes with my actual self and my ideal self have been brought as close together as possible. And that's not like, oh, I've made myself to be perfect. That is, I am living
Yeah.
within my values. What I care about is what I spend my time focusing on. That's what that means.
Yeah.
And so getting him to a place where he is capable of looking those thoughts in the face and saying, okay, yes, some of this really sucks. And these feelings are intense and miserable and terrible and horrifying. And I can find some temporary side door to set them in while I am working on using them instead of a hindrance, but more of a drive towards
Mm-hmm.
I need to figure out what I can influence here and how I can do that. And it's a very
Mm-hmm.
dialectical behavior therapy approach, or even acceptance and commitment therapy approach, to
Mm-hmm.
recognize facing your feelings as they exist and allowing them to exist is the way that they start to be able to move on. And getting to
Mm-hmm.
a place of, okay, well, now that they are starting to fade a little bit, now that I've accepted that they exist, this is when I start to feel empowered enough to actually take some action and make some changes. And
Mm-hmm.
for Dean Highbottom, it's clear again with the amount of power that he has, there is change that he could do given the opportunity. I won't necessarily spoil the ending just in case someone decided to brave this podcast without seeing the whole movie or reading the whole book. For reasons, he's not able to take any action. And the most clear reason that I feel confident communicating is that he clearly did not seek any therapy. But that we know of, I guess.
I think me and you had a similar long-term goal of addressing the feelings and addressing the reasons for all of the guilt. Um, the reason why those would be more long-term goals is because what the dean was saying in the intake was that it was hopeless. A lot of this was out of his control. He was being made to be this dean and to mentor or teach or lead these new generations. The thing that can be hard to look at is that true? Were you really being made to do this? Is there another option? Could you have not taken the job? Is that true that you've done everything you could do? Could you be doing more? And those questions you have to have good rapport with someone to ask those types of questions.
A lot of trust needed to be able to be in a place where you can hear that from someone. Plenty of work to be done for Dean Highbottom.
Yeah.
Is there anything that you feel like we haven't gotten to in our discussion of him yet that we want to mention before we wrap up for today?
So our next episode is going to be about Parks and Rec.
Woo!
We got this recommendation from one of our listeners, someone that I know. Her name is Erin. I'm really excited to do Parks and Rec. I really enjoyed the show. I'm not completely caught up yet. I haven't watched the full all the seasons. What about you, Haley?
Oh, I am a massive fan of Parks and Recreation. I have watched the entire series all the way through multiple times. In fact, as we say it, maybe it'll be time, even though I'm definitely intimately familiar with it, maybe it'll be time for a rewatch. I'm thrilled at how Parks and Rec is going to allow us to just be really light about it. The characters, while they do go through things, and while there are definitely going to be some things that we can help with, it's all very lighthearted, which will make it very fun. Although, as I say that, I also realize that some of our future plans might bar me from spending time just watching Parks and Rec because I have some other homework that I'm going to be doing. Would you like to talk about some of the things that we're going to be doing in the future after the next episode?
Yes. So these won't be in any particular order, but we are planning to do an episode on One Piece. So that'll be really exciting. Huge anime fan here. So I'm very, very excited about this. And we got a recommendation for Attack on Titan. So we're planning to also do that. Some of the other things that we're planning, and this one will be hopefully pretty soon, within the next few months, is Bridgerton. Haley, have you watched both seasons?
Yes. So I am also definitely a big Bridgerton fan. totally caught up on the show. Very excited to talk about that
Mhm.
one. I know it really well. It'll be funny because this will be a bit of a role reversal where I felt like there have been times that I was like, "Oh, Karla, you got to watch this. You got to read this. You got to take this in." Um, but with anime, I'm less experienced in that domain. I'm going to have to start watching One Piece and start watching Attack on Titan because I am as yet unfamiliar with them. But I'm so excited to do so because I not only do I hear wonderful things about them all the time, but my own clients recommend them to me all the time. I have a lot of
Mhm.
teenager clients, and so that is a common thing that I hear. So really excited to watch One Piece and Attack on Titan, and then, and of course Bridgerton. Love me some Bridgerton. Um, and we're also going to, as the airing of this episode, the Percy Jackson TV show from Disney Plus is actively being released, the first season. And I am so thrilled. I am a huge Percy Jackson fan as well, and read the whole books, the original book series, the original the original five of the Percy Jackson and the Olympians, and read it through multiple times. Another example of that. Love the TV show so far. So we're hoping that around the time that the first season of this show completes, then we'll be able to do a whole episode on a character from Percy Jackson.
Yeah. If any of you have any recommendations, we would love to hear it. We'd love any recommendations that we can get for shows that you like, or even characters that you would want us to do. Before we finish today, is there anything that we want to plug?
Well, we have, as usual, our social medias for this podcast. You can find us on TikTok or Instagram or YouTube, and of course, anywhere that you listen to podcasts. On TikTok and Instagram, we are at Character Clinic Pod. So that would be a great area to go see what we're announcing, see what's coming up
Mhm.
with us, see what we're talking about, and maybe if you wanted to add some comments of your requests or your thoughts, that would be a fantastic place to do so.
And I want to plug my own social media. So on Instagram, I'm at Karla Pineda OCD. And I do a lot of educational content around obsessive compulsive disorder, social anxiety, panic disorder. That's kind of what I focus on there. On TikTok, I'm at Karla Pineda LPC. Same thing, a lot of educational content. If you are in Texas looking for an OCD or anxiety specialist, my website is layerscs.com. I still have some space for individual clients. Also, I want to say that Haley has created her own social media and she didn't plug it. What's up with that?
Yes. I also have some. I am on TikTok and Instagram also as Counseling with Haley. Words separated by underscores.
And what do you focus on there?
In my Instagram account, I like to just it's quite varied. Cuz my area of focus is a little bit more broad, and so I talk about several different areas, and I'll just have little posts about them. Sometimes I'll just share, videos from our podcast, of course. But I'll talk about parenting things. I'll talk about people pleasing things. I'll talk about perfectionism. I'll talk about setting boundaries is a big one for me. So I talk about those kinds of things. I've started to use TikTok as like my own little personal therapisting journal, which is fun. Just a little quick thoughts just that need to get out into the ether. So it's entertaining if you would be interested in following along.
Okay, so that's going to be it for today's episode. I'm excited for the new year. So the next time that I guess when this is released, it'll be 2024.
Yes.
So I guess it is the new year.
Yeah, I should say at the time of recording, it is December 31st. So Happy New Year, everybody. But I guess you'll be hearing from us on January 4th.
Yes. All right. That'll be it. And we will see you in 2 weeks.
Sounds great.